Hello people, in this video we want to look at ankylosing spondylitis. So here you can see ankylosing spondylitis. So basically what do you mean by ankylo? Ankylo is like fusion. Spondylitis refers to the spine. So spondylo actually refers to the vertebra, they are saying. Okay. Here what can you see? Look at the healthy spine. The healthy spine, how the body of vertebra is, how the intervertebral discs are, right? See, if you draw this diagram, you will get good marks in the exam, okay? Practice this diagram. So here, what they're showing you, there's inflammation, right? There's inflammation. You can see some red, right? The vertebra, the joints actually of the vertebra, they are all inflamed. Inflammation of joint. First of all, you should understand what is the inflammation of the joints. Then what happens? There is fusion of the bones, and this will be called as bamboo spine. Okay. So how these people will be? They will have this whatever you're seeing here. This is the kyphosis, right? And this is the lordosis, right? So this this part of it, okay. This has become more, okay, in these people. So when they are looking also, their eye level is not at the correct level to look forward. Okay, so this is ankylosing spondylitis. So now let's learn this from the textbook. Ankylosing spondylitis defined as the presence of SacroIlitis. Guys, this is the definition you have to say. Presence of SacroIlitis on the X-ray. Okay, and there will be some structural changes which eventually will progress to the fusion, bony fusion of the spine. Okay. These people, more in men this is, and they'll be HLA B27 positive, they are saying. They will not have any functional limitation. They will enjoy a good quality of life only. That is the good thing about this, okay. Now, one thing is, this is sacroiliac joint, right? Why they are telling this is the first thing that appears, is it? And then it will go to bony fusion, is it? Because this is the sacroiliac joint. So the presence of SacroIlitis, right? Then there's bony fusion of spine, they are saying. Okay, let's look at the clinical features, how these people will come. Symptoms of spinal inflammation. What is that? These people mainly will have fatigue, okay, you should remember this. They'll have back pain, standard things. I'm sure you thought about back pain, right? Inflammatory back pain, early morning stiffness. See, early morning stiffness sounds so much like arthritis, right? Rheumatoid arthritis. Anyways, but this is also early morning stiffness, back pain, radiating to the buttocks. Back pain radiating to the buttocks. So you can understand here the sacroiliac joints are involved. That's what you should understand. Okay. Secondary osteoporosis can occur. So the bone density will reduce, and there can be vertebral fracture because of this. We told you that there is marked kyphosis. We told you, right? So what will happen? It will interfere with forward vision. So for this person, looking forward is only difficult, right? Because of the way his spine is. Then fatigue is major complaint. We told you this, and they don't know why it happens. Anterior uveitis is common. That is inflammation of the iris and the choroid and all, right? So eye, something to do with the eye, anterior uveitis. So this usually happens before the joint disease, they are saying. Very interesting. It looks like a lot of this they don't know still. Everywhere they are saying they don't know why it happens. So what investigation you'll order for these people? X-ray of the sacroiliac joint. See, you are trying to, it is affecting what? The vertebra and all that. But here they are saying you should take the X-ray of the sacroiliac joint. Okay. And you will see that there is irregularity, loss of cortical margin, widening of the joint space, sclerosis, joint space. Subsequently, it is narrowed and fusion. See, initially the joint space is wide. Then there is joint space narrowing and fusion. Okay. Then there is squaring of vertebrae. Bridging syndesmophytes, ossification. See, squaring of the vertebrae, what they're trying, you should understand. Anterior squaring of the vertebrae. Squaring, anterior squaring of the vertebrae, okay. Then, these are the extra articular features of the ankylosing spondylitis. You can look at this. So, we told you about fatigue, anterior uveitis, osteoporosis, all this we told you. Finally, all the vertebra, they'll fuse, and what are they calling it as? Bamboo spine. Okay, remember. Then we told you osteoporosis, what else? Erosive changes may be there in some of these joints. Then they're talking about MRI. If you want, you can do MRI. So this is all you can understand, right? MRI, X-ray, etc. What they're trying to say is you will not find rheumatoid factor, ACPA and ANA. This will be negative. This is what you should understand. This person doesn't have rheumatoid arthritis. He does not have the ACPA is not there means what? RF is not there means rheumatoid arthritis is not there. ANA, anti-nuclear antibodies are not there. So these people are not having this condition. Okay. What can be raised in these people? ESR and CRP, that is C-reactive protein, and the erythrocyte sedimentation rate are raised. Okay, so you should understand this. There is no RF, ACPA or ANA. ACPA is that citrulline something, right? Anti-citrullinated protein antibody, something that is. Okay, now how will you manage, guys? We have come to management, guys. Now we are coming to manage. How will you manage this guy? You have to make sure that his eyes, he can see correctly, right? Basically, he should be able to see correctly. This is what we should do. And progression of disease can we stop? Think what do you think is can be the treatment for these people. So here's the answer. Mobilizing exercises. You can give them NSAID long acting to alleviate morning stiffness, anti-TNF, that is tumor necrosis factor, right? Or anti-interleukin 17A therapy. This is very, very specific. If you can remember it, you can remember it. Some biologic therapies, then they are talking about glucocorticoid injection. So NSAID, glucocorticoid, this much you can remember, right? Then for uveitis, you give treatment, okay? Then arthroplasty, osteotomy. Osteotomy basically they're doing so that you can correct the stoop and make the eye line posture more normal, okay? That's it, guys. So this is all about ankylosing spondylitis. Hope you learned something. Bye bye.